BC's healthcare system continues to experience historic pressures, with several communities in the province warned yet again that their local hospital emergency department will be closed this weekend. The latest hospital to make the announcement is in Merritt, the second in Clearwater. Both were due to staffing shortages.
So the situation are relying more and more on the ambulance service to go farther and farther and carrying patients and doing more as the only healthcare in communities. And that really becomes problematic when we're so short-staffed.
The union representing BC ambulance paramedics also say that the ongoing ER closures are putting an even bigger strain on their workers. Ambulance Paramedics of BC is warning once again that there could be ambulance delays this weekend. Well, as monkeypox cases continue to rise, some former patients are sharing their experiences with the virus, in rare cases suffering from symptoms so painful they've been hospitalized. But by sharing their stories, they hope to normalize the conversation around monkeypox. So for more, we're joined by Haroon Tulanai. Now, he lives in the UK, where he contracted a severe case of monkeypox earlier this summer, and we've reached him in London. Good morning, Haroon.
Good morning, John.
First off, can I ask how you're doing?
I'm doing great. I'm fully recovered and everything is fine. Thank you very much.
Can you tell us a bit about the extent of the severity of the symptoms that you had to deal with?
Sure thing. It was in last June, and it started with very high fever, and I had to isolate in total 35 days. Unfortunately, the misdiagnosis I had at the beginning, because monkeypox was quite new back then, and with high fever and rash or swollen glands I had, gave the doctors the impression that I had tonsillitis or COVID or another infection, but monkeypox wasn't much a thing. So it just kind of delayed the access to the healthcare for me, and I got worse. When I was hospitalized, I wasn't able to eat or drink because my throat was shut with lesions, and the lesion on my nose got really bigger and really painful. So, I wasn't able to eat. So at the hospital, I stayed around 11 days. And I think 5 days later, my hospitalization, I started to swallow small sips of water. But because of the chills and extreme body pain and muscle pain, it was really scary. And after the hospital, I had to isolate a couple of weeks more until my doctors told me that I'm safe.
As you say, scary to experience, and as people are hearing about cases rising around the world, there is, I think, fair to say, a certain amount of fear. There may also be ignorance. We're going to show people some pictures of, you described some of the lesions, rather, and they're in some cases hard to look at because this has a way of manifesting itself in an ugly way. But you were talking about the challenges of getting into the healthcare system itself. Can you talk a bit about that in terms of the perhaps misunderstanding in the broader medical profession?
Of course, because monkeypox is a viral infection, it presents itself like any other viral condition with high fever and swollen glands. So you probably, when you have a flu or when you have another viral infection, it always starts with high fever and swollen glands. So when the condition is quite new, actually it's not new, it's for 40 years it has been around, but it is new to Europe and the West countries. So the doctors couldn't think of it. So they never thought of testing for it. That's why it took some time. I called emergency services 5-6 times to get help. But they're asking you random regular questions such as did you fall, did you lose blood? But the answer is no, because the only thing you have is very high fever, like 40 degrees Celsius. They couldn't think of it. It could be monkeypox. Eventually, because I wasn't able to eat or drink anymore, that was the reason I was hospitalized. And the monkeypox test result came back 3 days after my hospitalization. So it was quite a scary and unknown times for me, and unknowns made it more anxious for me.
Now, as I'm sure you know, many health experts and administrators around the world have talked specifically about the aspect of men who have sex with men and the way this is passed along. Others, of course, have said that the particular sector of society is being stigmatized. From a patient's point of view, your thoughts on the public health message that you think should be out there?
I completely agree that gay, bisexual, and MSM community is being targeted and being labeled because the disease is spread through these communities widely. However, people need to think that those communities are much smaller, so having the spread that quick and wider is kind of expected, but it doesn't make a condition belong to some certain groups. It is not right. We did the same mistake with HIV/AIDS for 30, 40 years ago. But now we know that viruses don't listen any boundaries. They may affect everybody. But also the media coverage, since it started in May, kind of lead to that because the spread was mainly in those communities. But since I have been sharing my story online, I've been receiving so many messages from people and from heterosexual couples in a monogamous relationship telling me that they didn't even had sex to have it true. So those kind of misconceptions, like this is only a sexually transmitted illness or it's only affecting gay community, is really wrong. It passes through skin contact. Even WHO explained that if you dance next to someone long time and contact them, you may be contracted with monkeypox, or sharing the beddings or the towels. So because gay community is widely impacted doesn't make the condition only a gay condition. So we have to get rid of this. And I've been getting lots of attacks because of that too. Some people still insist that this is a gay condition, and because I'm gay, I had it. And it is not right. We have lots of cases, non-MSM community right now.
Haroon, it's a brave thing to talk about your conditions and what you went through the way you have, and I appreciate you sharing your experience with us. Thank you so much.
Thank you very much, John.
That is monkeypox survivor Haroon Tulanai speaking to us from London.